A UK-based research team says it has found the first new treatment for asthma in 50 years. A study found AstraZeneca's injectable treatment for severe asthma is more effective during attacks than oral steroids. The antibody drug in the injection was approved by US and EU regulators in 2017 as a treatment for a more severe type of breathing disorder. The study says use of the drug cut the need for further treatment in patients by 30%. And joining me now is Dr. Richard Russell, head of the Department of Immunobiology at King's College London and one of the lead researchers. Doctor, thank you very much for joining us today.
Good afternoon, Roger. Lovely to be with you.
Can I say congratulations? Is that what in the medical field? Is that what you say for this?
I think that's good. I mean, this is very well, and actually clearly this is a positive message at a difficult time, and there is hope here for asthma and COPD sufferers with this new indication for this treatment.
So this has been around for a while for more severe asthma. Why was it not looked at to treat less severe cases?
I think we need to be careful. With what we're talking about here is treating attacks. So patients who have attacks of asthma, who actually then need new treatments, this treatment is very effective for them. I'm afraid it didn't affect other types of asthma, and we're using it in a different dose and a different, but in this way, it can be really very effective. I think the other thing that happened was people assumed that all attacks were the same, and they clearly are not. And for patients with a particular pattern of disease, this treatment is very effective.
And for this, you say a particular type of it. How many people are affected by this type? How many asthma patients?
Well, we reckon there's probably 50% of asthma attacks and 30% of attacks of COPD exacerbations have this particular pattern and would benefit from this treatment. So it's an awful lot of people worldwide.
And what kind of a difference does it make to these people?
Well, what we found was, in a group of around 160 people we studied, that if you give this treatment and compare it with our standard current treatment of steroids, there is a 54% improvement in outcomes. So this is a big change, and this would really be effective for many, many people. It makes them better quicker, and indeed, it seems that their improvement lasts longer.
And does this open up new paths or new possible treatments? Because now you've taken a look at this and you're starting to see some other directions you could head with it?
I think that's a really great question. I think we have to do a bigger study, multinational study, to confirm and make sure our findings are robust, and then we have to make sure we can use it in normal practice. How are we going to use this practicality-wise? This is a different dose to normal therapy, and actually we then would hope we can actually get this into mainstream. But you're absolutely correct. We need to be thinking in a molecular way, an inflammation way, about what is going on with these attacks and new therapies.
And one last question before we go. When can people expect to see this, assuming all the future testing and everything turns out positive?
Well, Roger, that is the best question. We really hope, this study group and those around the world really hope that we can get the big study funded. And if we can do that, we can probably turn that around in 2 to 2.5 years. And I would then love to be able to see this treatment being used in around 3 to 3.5 years. It should be very quick once we know the data is robust and we know how to use it.
Okay. Congratulations. And thank you again, Dr. Russell. Appreciate you talking to us.
It's great to be with you. Thank you, Roger.
Dr. Richard Russell is the head of the Department of Immunobiology at King's College London.